Now, if this happens immediately after a hair transplant, how are you going to feel? Well, this is the talk for the day. Shedding after hair transplant, what some people call as shock loss. So stay on and we're going to discuss it. Most people who have not done their research about hair transplant before they go in for the procedure, who have not been properly instructed by the clinic about what to expect immediately after hair transplant, get alarmed when hair starts falling off after 1 week. And this is commonly called as shock loss. And shock loss is a term coined by people who got shocked when they saw this. But you do not have to worry. Shock loss, when it happens, if a hair transplant has been done properly, is a temporary phenomenon. It happens with most of the people, almost 95% and above, and all the hair which gets shocked, fall off, shed, will all grow back in due course of time. Now, why does shedding happen? Why does shock loss happen? When we harvest grafts from the donor area, they are, for some period of time, devoid of their natural blood supply. They subsist only by a process called imbibition, that is sucking in nutrients from the preserving solution. And in our case, since we follow in vivo preservation of grafts continue to be in the donor area, attached by a thin pedicle at the base and bathed by blood, plasma all around. So they continue to subsist on this till they are removed and speedily put back in the recipient holes. So in our technique, which is the direct hair anagen intensive hair transplant technique using the in vivo preservation of grafts, which reduces out-of-body time, shedding is much lesser than in traditional forms of FUE and FUT. So when the hair is out of the body, it goes into the survival mode. Now, whenever a tissue goes into survival mode, it will shed unnecessary baggage. And for a graft, the unnecessary baggage is the hair shaft. So it gets shed. The hair goes into telogen phase. The hair goes into telogen phase for a few weeks, after which it re-enters the anagen phase and starts to grow a new hair. So when do we expect shedding to happen? Shedding usually happens anytime between 1 week to 5 weeks, at sometimes 6 weeks. Within 4 to 8 weeks, the hair which has gone into the telogen phase re-enters the anagen phase, starts growing a new hair which emerges from the skin surface by 3.5 months to 4 months. But it's wispy thin. It is only by 5 to 6 months that it looks like terminal hair, and the result comes between 6 to 9 months. That is the timeline of hair transplant regrowth. I've already done a video on this and you can see the link above. But there are people who do not shed at all. These are less than 5% people who do not shed 100%. Well, what is the difference in the result that people will obtain, people who shed versus people who do not shed? Whether your hair shed or they do not shed after hair transplant, you are still headed towards similar outcomes as far as the result after hair transplant is concerned. After 6 months and up to 9 months, you will see growth whether you shed or you do not shed. People get alarmed when they shed, and people get more alarmed when cracks appear in their crusting. Why do cracks appear before the shedding process? Because the patient has not been following treatment as far as spraying intermittently is concerned immediately after hair transplant, especially in the first 24 hours. Because oozing of blood, oozing of plasma happens, this forms caking along the skin surface in the recipient area. Now this caking, when it dries out within 5 to 7 days, when it desiccates, it forms these cracks. And then the hair shedding occurs all at once, and this makes the patient alarmed, distraught, and most patients panic. Patients panic because they've not been told about the shedding process. Well, if you've been told by your clinic about the shedding process, when you expect it, your trepidation will not be as much as when you're not properly researched. Now, shedding can happen in the recipient area. It can happen in the non-recipient area of the thinning scalp, and thirdly, it can also happen in the donor area. Now this brings us to the 3 forms of shedding in anatomical regions. Number 1, the shedding in the recipient area. Shedding in recipient area happens because of temporary disruption of blood supply, the shock that the scalp experiences after multiple incision injuries. This can also extend into the thinning hair which are in the non-recipient area. And this happens because these hair may be miniaturized. They may be miniaturizing And these hair might be in the last few cycles of their presence on the scalp before being involved in the balding process and falling off permanently. So they will only fall off sooner than they would otherwise have in 6 months to 1 year or 2 years. Whereas in the balding area, all the hair will recover because they'll soon enter the anagen phase. In the non-recipient area, native thinning hair, if the hair were in their last few cycles of existence, they may not come back. And this becomes even worse if we do plantation within miniaturizing hair. In such cases, 20 to 50% of hair may fall off permanently immediately. Hair can also shed even if they are good anagen hair because of healing taking place in the vicinity, blood supply getting disrupted in the vicinity, but these hair will always come back, unlike miniaturizing thinning hair, which have a high propensity of falling off forever. And then we come to donor effluvium. Donor hair effluvium is rather rare. It only happens if we have not selected the patient properly. If a patient who has significant miniaturization of donor hair has been selected for surgery, there is bound to be massive shedding if we cause trauma during the harvesting process. Whether we overharvest or we do not overharvest, there is going to be significant amount of shedding which may be permanent in the donor area if the patient has not been selected properly. If the patient has significant amount of miniaturization and you have subjected him to donor harvesting. Now, what if your hair doesn't shed at all? Does it mean that not getting shedding will not give you good results? No, this is not true. Whether your hair shed or your hair do not shed, the result will be the same, provided the process of hair transplant was immaculately done. People who do not shed form less than 5% of the patient clientele. They do not shed because their hair, due to some reason, unexplained, have not entered into the telogen phase. They continue to remain in the anagen phase and continue to grow from day one, and these patients get an early hair transplant result which you otherwise get between 6 to 9 months. They may get between 3 to 5 months. And this calls for celebration. They have merely bypassed the shedding phase, that is the ugly duckling phase, and grow much faster. So how do we minimize shedding? Is there a way to minimize shedding? Yes, there are mechanisms by which we can decrease the amount of shedding an individual will go through. Now, if you have significant amounts of miniaturizing hair, many people have some amount of miniaturization when they have extensive baldness, and especially true for those who are young in age and whose baldness is not stable. These are the ideal candidates who will have massive shedding after the hair transplant procedure. So how do we prepare ourselves before hair transplant to minimize the damage by shedding? Well, in patients who are young, whose baldness is progressing at a rapid pace, it is very important to stabilize your hair loss before going into the procedure by taking finasteride for at least 1 to 4 months. These patients, if they prime their hair properly, make their miniaturizing hair robust before they go into the procedure, will get minimal shedding and get better results. Minoxidil also makes the hair robust and able to withstand the trauma of hypoxia and relocation. Now, when amateurs go into hair transplant, they think that dense packing gives always great results. Well, let me tell you that any amount of grafts more than 55 per centimeter square may be not a wise thing to do, because all the hair may not be able to compete with each other for the blood supply, for the meager blood supply that they have, and may all fall off by the all or none phenomenon. This shedding may be permanent and may result in patchiness and also scarring and cannot be corrected in future. So this is a red flag sign if someone tells you that you will get a density of 75 per centimeter square. The body is not a non-living tissue that you can stuff as much as you possibly can. It's not a mechanical thing. You're playing around with biological living tissue which has its limitations of blood supply. If you make incisions too close to one another, the skin can die off by a process of necrosis. Leave alone the grafts competing with one another for meager blood supply for 75 grafts which have been crowded in a small area of 1 centimeter square. So this sort of shedding may be irreversible. Another shedding which may be permanent, destroying a lot of native hair which may otherwise have survived for 5-10 years, is when you go into an area which though may be thinning, but the density is near normal. Never do a hair transplant when the density is not less than 50%. Because when we make incisions around follicles, blood supply gets cut off. They get shocked by slits which are just next to the stem cells. Also, when a lot of anesthesia, a lot of tumescence, plumping of the recipient area is done by infusing a lot of saline under the skin, this also disrupts blood supply and causes massive shedding which may be permanent. And lastly, permanent shedding can also happen if the grafts were not placed properly. If there was a kink at the end of the bulb, these grafts are not going to survive. They will fall off and not regrow. Grafts which are placed very superficially, where the bulge, which contains the stem cells, is showing out of the skin surface, will not grow properly because the stem cells are going to desiccate, and this will affect your result. All these hairs will be lost permanently. So this was about shedding. If you experience shedding, please do not get alarmed. It's a natural process of the body. It's a natural healing process. Hair are going to all regrow and everything will be fine. Thank you for watching again. If you have any questions about this talk on shedding after hair transplant, shock loss after hair transplant, or any issue that you face about hair transplant in India, about hair loss management for men and women, do let me know and I'll be there to help you. Have a nice day and may God bless you.